Hello, I'm Dr. Sheila Wright, autogenic trainer and retired lecturer in psycho-oncology, Dublin City University School of Nursing, Psychotherapy and Community Health. I would like to gratefully acknowledge all who have worked at the COVID-19 frontline in recent times or now. We owe you a major debt of gratitude. Thank you. Very many thanks to Christina Donnelly for kindly inviting me to submit this video, and to Chair of the British Autogenic Society, Judith Wren, and the BAS trustees for their ongoing invaluable support and guidance for Autogenic Training Ireland projects. I'm going to outline a few stress management and relaxation techniques that you might find useful at this time, beginning with an explanation of their mechanisms and a little bit of the background theory in very basic terms. Firstly, to emphasize safety aspects of all relaxation techniques, especially for people with chronic pain syndromes. You will be aware if some of your body systems are not functioning as they normally should. This is known as dysregulation. If you are a person who feels weak, or who has dizzy spells, or you suffer from vertigo, even occasionally, please be particularly careful. You are strongly advised to talk with your general practitioner before doing any types of relaxation exercises. For safety, anyone who takes an autogenic training program with me is obliged to obtain permission from their general practitioner or their physician following a pre-AT assessment, because autogenic training, known as AT, is very strong. Two emotions often associated with the stress response are anger and fear. Anger can be overwhelming and dangerous when uncontrolled. A person with pain may feel anger at reduction of loss of many aspects of their quality of life. However, everyone can learn to manage anger constructively and to use behaviors to achieve an improved health outcome, and can learn to offload anger with specific anger offloading exercises. In the context of pain, fear can be very damaging. Fear of pain, along with catastrophic thoughts, can reduce a person's motivation to be active and mobile, potentially running the risk of disability and greatly reducing quality of life. Stress management techniques are focused on balancing the autonomic nervous system, which comprises the sympathetic and parasympathetic nervous systems. The sympathetic nervous system increases heart rate and breathing, restricts digestion, and constricts peripheral blood vessels, the body's way of mobilizing us for the fight or flight response. In contrast, the parasympathetic nervous system decreases heart rate, slows breathing, our digestion is stimulated, and peripheral blood vessels dilate. This is the system of calmness. Ideally, we have a balance between the two systems. However, there is a design flaw, and our biopsychophysiology, while optimal for hunter-gatherer times, hasn't evolved to respond quickly to modern stressors. When stressors are intense, ongoing, or frequent, the sympathetic system tends to stay in arousal mode, impacting mood and behavior, with potentially serious implications for longer-term health. High levels of stress hormones can do damage over time to bodily structures and mechanisms, so that bodily systems become dysregulated. People with pain sometimes find their prescribed medications problematic. People with chronic pain syndromes may have dysregulated autonomic nervous systems and damaged pain receptors. Finding a suitable pain management medication treatment regimen requires an individualized approach to ascertain what works best. Pain management is not one size fits all. So we're going to look at where some stress management models came from in the last century. Firstly, a physiological model. the concepts of homeostasis, that is the interaction of bodily systems to maintain an optimal internal environment, and fight or flight response were first described by Harvard physiologist Walter B. Cannon around the 1915 time. Cannon's work focused on the sympathetic adrenal medullary, that is the SAM axis, and the role of adrenaline in acute stress. Then a medico-physiological model was put forward by endocrinologist Hans Selye in the 1950s. Selye is most recognized for his general adaptation syndrome, later renamed the stress response. Selye's work with laboratory rats focused on the hypothalamic pituitary adrenal, that's the HPA axis, and chronic stress. Richard Lazarus and Susan Folkman in 1984 put forward the cognitive transactional model. This model considers the interaction of the person's perceptions of environmental events and whether these are appraised as threat, harm, challenge, benign, and the person's consideration themselves of the resources they have to cope with those events. This model is an interaction of the person with their environment. More recent models take all of the above with relevant changes in the light of updated research and include also the impact of genetics, individual differences in reactivity, and relevance of psychosocial and biogenic stressors. This is the axis that Cannon researched, the acute SAM axis, where the hypothalamus stimulates the adrenal medulla to produce adrenaline, which underpins the fight or flight response and associated physiological reactions in acute stress. And this is the axis, the HPA axis, which was researched by Selye. The hypothalamus interacts with the pituitary gland to stimulate the adrenal cortex to produce corticosteroids and minerosteroids, which in the longer term is the problem because cortisol in the longer term is damaging. In the 1970s, American psychiatrist Professor George Engel introduced the biopsychosocial model in order to humanize psychiatry, recognizing that the dominant medical model was completely inadequate to understand and treat the complexity of mental illness. I invite you to go to the website of the Irish Pain Society and view the presentation on the biopsychosocial model and chronic pain by Professor Gert Combes, as well as the other guest speaker presentations. Some of Professor George Engel's most early papers are free to read on Google Scholar, and you might enjoy them. Engel recognized that it is essential to include all aspects of social context, including a person's thinking, in understanding a person's experience and illness. The biopsychosocial model is now absolutely accepted as best practice in chronic pain management internationally by professional bodies of all healthcare professionals. Early examples of change in prescribing patterns are now illustrating this attitude shift. Change leader GPs are beginning to prescribe cycling for weight management and visits to green spaces for mental health. Just as patients with cancer ought to have access to psychological interventions to cope with difficult cancer treatments, championed by British cancer psychologist Dame Professor Leslie Fallowfield, Professor of Psycho-Oncology, Sussex University, UK, and her international colleagues, patients with chronic pain internationally have fought hard for access to psychological aspects of care, to be empowered to better self-manage their pain and related symptoms, to have fewer medications, require less access to health services, and have better health outcomes. Use of self-management skills in the context of multidisciplinary pain management is accepted best practice. Champions of this patient-centered change in care include renowned Professor Mika Sadie, Professor of Psychology at Cedar Crest College, Pennsylvania, and patron of the British Autogenic Society, as well as many other internationally renowned healthcare professionals from different disciplines. I am a member of the committee for the Irish Pain Society, as some of you will know, and the Irish Pain Society is a chapter of the International Association for the Study of Pain, so we are very, very strong in our support of these changes. And if you explore the website of the Irish Pain Society, you will see the policy there that outlines this. I recommend the book written by Professor Sadie, which is on the reference list at the end of this presentation. And Professor Sadie states, within the context of the biopsychosocial model of pain management, psychophysiological techniques play an important role in the treatment process, and once combined with other interventions, they can bring about significant changes in the overall functioning of the patient, reduce helplessness, and increase self-efficacy. So now we're going to look quickly at coping skills, which depend on resources, as we know, related to health and energy, how we believe, how we think about ourselves, if we have positive self-belief, if we have problem-solving skills, social skills, and access to material resources is hugely helpful to help us cope. And having a sense of being able to cope confers self-esteem and self-efficacy. And one of the helpful techniques for problem-focused coping includes good decision-making and information gathering, goal setting. Very constructive, also puts us in contact with people who can help us. So that is a very strong form of social support and informational support, and very likely emotional support as well. And that can be very beneficial. Emotion-focused coping has two types: maladaptive, which is smoking, alcohol consumption, needless as opposed to necessary, sickness absence, and substance abuse. And when people with pain find they're using these techniques, they often want to do something about that, because these techniques obviously reduce quality of life. So adaptive emotion-focused coping focuses on stress control techniques, as well as using those effective coping mechanisms. The adaptive stress control techniques are aimed at changing the internal environment, because when a person is in the parasympathetic mode and not stressed, it helps to change the perception of the stressor from threat to challenge. And that increases sense of control, efficacy, and resilience, resilience being the capacity to bounce back. So we're all at this stage well aware of the benefits of the relaxation response and what is required to bring the relaxation response about. Benson's book is referenced in the list at the end of this presentation, and no doubt you're all familiar with Benson's excellent book. The relaxation response does not require a quiet environment. It does require a mental device, something pleasant in our mind, a nice scene, piece of music, or a nice plant, something that is pleasant to think about, as well as a passive attitude to allow the response to take place, not to force it, not to try to force it. A comfortable position isn't necessary for the relaxation response, so we can induce the relaxation response by going out and walking in a green space, or exploring somewhere where there's pleasant scenery. The relaxation response promotes decreased heart rate, lower metabolism, decreased rate of breathing, slower brain waves, as outlined describing the parasympathetic nervous system activity. And the purpose of relaxation techniques is to deactivate the five senses away from those stimulating stimuli that are potentially stressful and their associated perceptions, and replace those stressful stimuli and perceptions with non-threatening, lovely sensations, music, something nice to look at, something nice to think about, which help to promote the relaxation response. Use them alongside coping techniques, know several techniques, practice fairly frequently, 3 times a day, 5 to 10 minutes at a time. That's where the benefits accrue. If we practice relaxation techniques once every 6 weeks, we're not going to benefit. Daily practice, short time, every day, that's what brings the benefits. Begin with a body scan. We're going to outline the body scan, because helps us to see, are we comfortable, are we going to benefit from this exercise. Close at the end of the session if feeling weak or dizzy, because that helps to bring back a bit of tension into our body system. So we're going to talk through those now. So a gentle, quick body scan. Doesn't need to be perfect, it's quick. Just to see if there are any tensions or discomforts which can be easily removed before beginning a relaxation exercise. So be seated as you like, comfortably, lie down or in a chair as you prefer. Draw your attention to the sounds inside and outside the room and let them be. For a person with unrelieved chronic pain, note where your pain locations are, then move to the next location in the body scan, ensuring there's no strain placed on any muscle group. The purpose of this exercise is to try to be as comfortable as you can before you begin your relaxation exercise, but to do that quickly. Mentally starting from your toes, quickly in your mind, check your feet, ankles, walking up the body via calves, shins, knees, thighs, hips, lower back, shoulder blades and shoulders, checking for any tension and adjusting your posture to be as comfortable as possible. Then checking upper arms, elbows, forearms, wrists, hands and fingers, noting any tension and adjusting your posture to be as comfortable as possible. Then checking the stomach, chest, neck, back of the neck, scalp, forehead, eyes, nose and mouth, noting any tension and adjusting your posture to be as comfortable as possible. Know where your tongue is in your jaw. So we go ahead with our relaxation exercise, and at the end of the relaxation exercise, for safety purposes, we close. And this returns the mind and body to a state of alertness and introduces tension into upper body. To remember that as we age, the elasticity of our circulatory system isn't so good, and blood can pool in our lower extremities if we're sitting for a while. So if we do a relaxation exercise, we are at a little bit of risk of feeling lightheaded to do this exercise and to get up slowly at the end of the exercise. So how to do the close? Close your eyes with arms down, hands resting on knees, make fists with your hands. Flex your arms and bring your fists quickly to your shoulders. Breathe in deeply, breathe out. Stretch out your arms, wiggle your fingers, and feel the tension in your arms and upper chest. Open your eyes. So now we're going to just run through a few techniques. Diaphragmatic breathing, one of the easiest and most effective methods of relaxation. This technique is strong. Everybody knows it, but it's strong, and it really does bring on the relaxation response. So this is one you have to be careful of. If you have any kind of orthostatic hypotension, any tendency to feel dizzy, any tendency to feel weak, you need to be careful to do your body scan and to do your close after you've done this technique. In yoga, this technique is called the pranayama. There's a nice website there which demonstrates the technique perfectly. There are 4 phases of diaphragmatic breathing. Phase 1 is the inspiration, phase 2 is a slight pause, phase 3 is the exhalation, phase 4 is another slight pause. The key to diaphragmatic breathing is to allow the abdomen to extend out. So one hand on the upper chest, one hand on the tummy, and as we breathe in for 5 if you can manage it. 1, 2, 3, 4, 5, pause, 2, out, 2, 3, 4, 5, pause, 2. And you could feel your tummy, your abdomen expanding as the diaphragm contracts. This is in contrast to hyperventilation, which is breathing in our upper chest, which can often occur when we're very stressed, the way a person who's distressed can breathe very rapidly in their upper chest, and this has implications for whole body function. So again, diaphragmatic breathing, adopt your posture of choice, do your body scan, breathe in, 1, 2, 3, 4, 5, pause, 2, breathe out, 2, 3, 4, 5, pause, 2. progressive muscular relaxation was researched very intensely by physician, physiologist, and psychiatrist Dr. Jakobson in the 1920s. Jakobson's research showed the impact of stress on muscle fibers, which shortened and continued to shorten if stress was unremitting. This technique is very quick and effective for anxiety. It's an excellent technique for anxiety release. Strongly recommended. Again, it's very strong. Jakobson introduced psychological techniques to medicine, and later this aspect of medicine became psychosomatic medicine. And Jakobson also invented biofeedback concepts. So Jakobson showed that muscle tension could impact all the body, and the importance of releasing muscle stress so that muscles themselves could function properly, because muscles that are completely tensed up and stiff and shortened, with shortened fibers, lead to stiffness, pain, discomfort, distortion, disaligned posture and joint instability, as well as other organic issues. So here is the exercise outlined. Again, find a posture of your choice. I recommend sitting for this exercise. You can lie down, but it's best exercise is best done seated on a dining chair. Do the body scan to start with, and for this exercise, a person works up the body from the toes and feet every time. We always start at the toes and feet, and works up the body via the major muscle groups, tensing the major muscle groups, each group 3 times. First tension, fourth contraction. The first contraction is for as hard as the person can contract. They then hold that for 5 to 10 seconds. They release and they relax. And they compare how they feel when they're relaxed to how they felt when they contracted their muscles. So repeat this exercise about 50% as much tension as the first exercise. Hold for 5 to 10 seconds, release and relax, and exhale. Compare the relaxation to the contraction, because as we're relaxing, we usually breathe in when we're contracting, and we release and relax, exhale. Compare the relaxation to the contraction. And for the third contraction, it's tensing again. Only a little bit, 5 to 10% of the first level of contraction. Hold for 5 to 10 seconds, release, relax, and then exhale. Compare relaxation to contraction. And then at the end, through the whole body. A point of safety for this particular exercise. It's very, very strong. And for people with diagnosed osteopenia or osteoporosis, you need to be very careful when you're doing the strong muscle tension that you don't run the risk of fracture, bone fracture. So just to be very careful, and you might check with your general practitioner or your physician about the safety of this exercise for you. Similarly, with respect for people with advanced bone metastases and cancer, this exercise is not recommended because of the risk of fracture. I'd like to draw your attention to this website in California, heartmath.com. This technology and research is based on 20 years of evidence-based research studying the heart rate variability and the interaction of the heart and the brain. Heart rate variability is the beat-to-beat difference in our heart rate, which we're not generally aware of. We know about our heart rate. We don't really become aware of the fact that there's actually a difference in time between each beat. It's very minuscule, and it's very strong when we're younger. It's a marker of health, of adaptability in the parasympathetic and the sympathetic nervous system to balance out the homeostatic part of the autonomic nervous system, which we lose over time as we age. And this technology has found a way to bring the heart rate variability, to make it more accessible to people, again, through doing exercises that focus on linking how we feel with how our heartbeat is functioning. And it has been found that if we're feeling very stressed and frustrated, then our heart rate variability isn't very good. But if we are more positive in our emotions, particularly with feelings of appreciation, and we practice this technique over time, we can bring back a level of heart rate variability that is very healthy. And our heart rate and our brain, our heart and our brain are in contact with each other all the time. The heart sends many messages to the brain frequently, and they work together. And how our heart rate variability functions is impacting on how our brain functions and the thoughts we're having and the decisions we're making. So it's very, very relevant to good mental and physiological health. There are free COVID-19 resources on the website, which I'm sure many of you will find very interesting and helpful. There are breathing techniques outlined and demonstrated for you to practice. Access is free. You're given a password, by return email. Very nice resources. The technology that has been developed based on this research is also outlined and available to purchase, and you might consider whether you'd like to buy yourself an early Christmas present. So now we come to autogenic training, which is a mind-body technique which originated at the beginning of the 20th century from research on hypnosis. And I would just like to comment there to make it very clear, autogenic training is not hypnosis. Autogenic training was developed from research on hypnosis by Johannes Schultz, a German neurologist. At that time, hypnosis and psychoanalysis were the two major interventions used by physicians and psychiatrists for mental health treatments for people. Schultz and his mentors recognized that the people they were treating with hypnosis were able to induce feelings of warmth and heaviness, which they hadn't been asked to do. So Schultz recognized they were inducing these feelings themselves. And he was very keen to find out, how are they doing this? There's some little mechanism there, a switch he called it, that they're managing to switch into this particular state for themselves. Therefore, they're actually bringing about some type of self-induced hypnotic state. So Schultz saw an opportunity that people themselves could become independent of the therapist. The technique is based on self-suggestion. It is self-generated. The AT trainer is a teacher who just provides the advice and information, and once the person, the trainee, has acquired the technique, they have it themselves for life. It enables the person, through passive concentration, to revert from activity in the sympathetic nervous system to parasympathetic nervous system activity, leading to a rebalancing of the systems. So while the initial two mental exercises associated with autogenic training, there are 6 standard exercises. The first 2 focus on warmth and heaviness, and they induce lovely vasodilation and muscle relaxation. And that's the relaxation part of it. And thereafter, the mental exercises focus on the regulation of the autonomic nervous system, very much focus on rebalancing the systems in the body, homeostasis. So AT is designed to reinforce the organism's natural tendency for homeostasis. Now, when we go into this state produced by practice of autogenic training, which is called the autogenic state, very, very pleasant state of feeling warmth and heaviness and balance in all systems, some negative issues that haven't been dealt with, they come to the surface. And Schultz's colleague Luther developed offloading exercises for feelings like anger and anxiety to help cope with those negative emotions and help offload them and learn to utilize them constructively for change in one's life. There is a strong evidence base showing the impact, a positive impact of autogenic training on quality of life and coping and symptom reduction across different types of pathologies. And for people with chronic pain, studies show that autogenic training is most helpful for improving sleep, reducing anxiety and pain intensity, and other symptoms that go along with chronic pain experience. It's a very strong process which enables the mind and body to find balance. And it isn't suitable for everyone. Some people do extraordinarily well with autogenic training. Most people do very well. Some people don't benefit so very well. It's a very much an individual thing. Just one of the ways that we cannot ever promise how autogenic training is going to be for you. You can only say, give it a go. This may be life-changing for you. It may certainly make a major difference to how you manage your chronic pain experience. But it doesn't have that impact for everyone. So everyone who wants to do an autogenic training program has to go through a pre-AT assessment to ensure that it is safe for them to go ahead. And then after that pre-AT assessment, they are requested to obtain the written consent of their general practitioner or their physician, because the pre-AT assessment may raise issues that need to be addressed by the GP or the physician. So safety is absolutely fundamental to this very strong technique. There are 3 basic positions: dining chair, armchair, and lying down. No special equipment, no special clothing. 6 simple mental exercises which are evidence-based, developed by Schultz in the 1920s. Use of a diary for the trainee during their learning program. Regular 3 times daily, 5 to 10 minutes practice, that's all that it requires. The use of the body scan before each session, use of the closing technique after each session, and there's optimization of lifestyle discussions, just brief optimization of lifestyle discussions, individualized for each person as they choose. It's very much, what do you want to help you? How do you see autogenic training as helping you in your life? As some of you know, I have been offering pro bono autogenic training programs in the autumn time at Carmichael House, and now we're going to go online on a pilot. This is not a research-based program. This is a pro bono program online, and very kindly, Christina Donnelly is, as always, going to help with the administration. So we're going to put a link in the e-Zoom that you can access if you would like to register your interest for doing the program. It will probably be 1 hour a week online over 10 to 12 weeks. So we are still constructing the timetable at the moment. Some physiological changes during autogenic training, reduction of muscle tone and blood pressure from heaviness, warmth, increased peripheral vasodilation, slowing of the heart rate, improved oxygen utilization, a shift from thoracic to abdominal breathing, sun rays warmth, more blood flow to the gastric mucosa, and this is where we would individualize the mental exercises if there was some personal adjustment to be made for each trainee, depending on their own symptoms. Sometimes the exercises have to be reduced or omitted. And then cool forehead with brain waves that indicate stimulation and alertness, going into more tranquil and calm brain waves. ECG studies of autogenic training show that autogenic training is a pre-sleep state. It is not a state of hypnosis, it is a pre-sleep state. Just to comment on physical activity, do consider physical activity as a remit for relaxation, excretion of anger hormones, stimulation of natural painkillers, helps the feel-good factor, getting out, cycling, walking in green space, all helps to convert negative energy to positive energy and use. Very many thanks.